we've always done it this way. I think those are the most dangerous words that I will hear. Worked with a group just last week, and they said, oh yeah, we soak all of our instruments in a chemical disinfectant. And I said, why? You're going to sterilize them. Why? Well, that's the way we've always done it.
Karen Gregory has been behind the scenes for over 2 decades, shaping the foundation for how dentistry understands and implements clinical compliance. She is now a nationally recognized speaker on the topic, certified in dental infection prevention and control, a previous ADS board of director and conference chairman for Dental Infection Control Bootcamp, and a lifetime award winner. She has taken her vast experience and founded Karen Gregory Consulting, which is an organization dedicated to helping practices create a culture of safety. Her commitment to safety has led her to become the leading voice in how dental professionals can become a safe haven for human trafficking victims that are brought in for dental work.
Up to 80% of people that are being trafficked interact with healthcare. There is the opportunity to touch on that as healthcare providers. It's the whole person. It's not just the teeth.
You started from a nursing medical background, right?
did.
You're a registered nurse. So tell me how you ended up getting stuck in dentistry, which is the term I hear so many people use.
Well, I don't feel like I'm stuck. I feel like I found my place.
Yeah.
So that's a little bit of a different mindset. There was no plan there. It was quite accidental. Actually, and this kind of goes back to when I decided to be a nurse.
Yeah.
I remember where I was standing, and my dad was talking to me, and he said, when I went to nursing school, you could go to a 3-year program and be a real nurse. That's what we talked about. You're going to be a real nurse, or you could go and get a 4-year degree, your bachelor's in nursing. And I said, I want to be a real nurse. I want to take care of patients.
Yeah.
And why would I need my bachelor's degree? And he said, well, one day you might want to teach. And I literally stomped my foot and I said, I'll never teach.
Really?
He's laughing in heaven.
Oh, I'm sure.
He really is laughing in heaven. And so through the course of my work, someone that I was working with took an interest in me and said, why don't you come write some policies and procedures for our organization? I was actually working for Kaiser.
Oh, wow.
And then an education job came open, and I felt like I didn't have the credentials to do that. But she said, just apply. And I got the job and just quickly figured out how much I loved that space of safety. Well, fast forward probably another 8 years, and this company, Total Medical Compliance, approached me. Hey, we want you to come and work with us, and we take care of medical and dental practices. And I said, ooh, I don't like the dentist. It makes me really nervous. But went to work for them and had to learn about dentistry, and just fell in love with it. It just seemed easy. The people that I engaged with wanted to learn. Not that the medical people didn't, but it was more of a, we don't understand this. Will you help us understand it? And what can we do to make sure that things are safe? And that's just kind of it. I remember the first time I ever did a truly official dental-only presentation, there was probably 300 or 400 people in the room.
Wow.
I was really nervous.
Yeah.
And so I walk around when I present, and I was at a stage where I said something about being a nurse. And as I was walking past this lady, she said, oh, nurses are the worst patients. And I thought, oh, this is going to go really well.
Oh, man, yeah.
today. But that was kind of my trial by fire.
Yeah,
And past that, I found people to be very receptive and want to do what's right.
Yeah, open and receptive.
Open to,
that's so great.
Okay, we're doing what we think is right.
Yeah.
Because Sally taught us to do that legacy training.
Yeah.
But when you push back and ask why, they can't tell you why. But once they understand why, then oftentimes they want to change.
Yeah. What did you pull over from medical that applied in dental? Because you've really been, even through nursing, it felt like you had a pull towards compliance
Yes.
and putting structure around safety, even in medical. Like
Oh,
you did that a lot.
That's where I started.
Yeah.
I mean,
Yeah,
I did
totally.
some bedside nursing. I worked in the operating room, but the majority of my outpatient career in medical was education.
Yeah.
And so remember coming to what is now ADS, OSAP meeting.
Yeah.
It was my very first one. And I'm sitting in the audience, and they had a physician,
Yeah.
a medical doctor, on stage talking about first do no harm. And I thought, wait a minute. We've been talking about this for 10 years on the medical side of the business. So this reality of patient safety was not well ingrained in what I was seeing happening in dentistry. And that is more on the forefront now, more structure, more accountability, because, we definitely knew on the medical side of the business, these are the things that you had to do.
Totally.
A lot of oversight from regulatory agencies. And I didn't see that. I still don't see that as much in dentistry. So it's a pretty much nobody's watching at times. And so maybe we don't have to be as diligent as we should be. And that's I think because of the lack of official oversight that I saw in medicine, I see a little bit of leeway to maybe not be as compliant as you could be, which is kind of sad. But let me balance that with sometimes also it's because you just don't know what you don't know.
For sure.
And it's very rare that I run into a situation now in dentistry where I stand in front of somebody and say, but listen to this, and this is why, and this is the impact, that they don't go, we get it. Let's do it.
Yeah.
Does that make sense?
Oh, totally.
Yeah. So, that's kind of, it was a little bit surprising when I became more involved in the whole delivery of oral health care.
Well, I wanted to ask kind of a follow-up to that, which is, how have you seen that? Is that changing since your transition into dental? Like, is like ADS becoming part of that? Do you see that beginning to happen now where we're creating structure at a regulatory level that's helping create clarity at the office level?
Okay, so this was 15 years ago.
Yeah.
That's how long ago
it
was that I really stepped more into the dentistry side of the business. And I would say yes, but then I would also go, there's still a lot of room for improvement as far as accountability. Are you keeping track of infections in your practice? Is there some type of report up process where that's been being looked at? I hear more consistently at conferences and things of that nature where what the minimum expectation for safe care is, or your safety, that's being discussed and the information's correct.
Yeah.
Okay. I see that more now than I did then. Now, let me also just say I wasn't as involved then. So it may have been going on and I just wasn't as aware of it.
Sure.
But I do see it popping up more as far as this is what you should be doing.
Yeah.
But if there is not a consistent standard. So right now we have all of these guidelines and sometimes you will hear, but that's just a guideline. It's not a law.
We hear that a lot.
Okay.
Yeah.
So let me just say, and I think later on we might talk about some of the time that I spent as a risk manager.
Yeah.
Only a year. 1 year, I cried every night when I went home because I only dealt with the bad outcomes.
Right. Yeah.
Right.
Yeah.
And so what I learned from there is there doesn't necessarily have to be a law for you to be held accountable. If you cause patient harm and you're not doing what another comparable healthcare provider would do, then you're going to be held accountable. And so where do we find that in dentistry? CDC's guidelines. We see some guidance from the ADA. ADS is going to be stepping up and maybe making it more clear. There's some gray areas in that 2003 guidance. So let's make it more clear for individuals so they know what they're walking into and what they should be doing, and take out that wiggle room of, it's just a guideline. Because that will make the hair on the back of my neck stand up. Guideline or law, what's going to happen to your worker? And I think there's more laws about worker protection, than when we look at from a patient safety perspective. So, and that I think could greatly be shored up, for lack of a better word.
No, I think that's appropriate. And I think, I'm curious how you navigate that when you're feeling that tension with an office, and it's like, right, because there is so much that they potentially could be or should be doing.
Right.
And so they're trying to balance that, like, I already have a ton on my plate, or I don't have the finances, whatever. How do you balance that conversation of like, this is what the standard of care should be, and how do we get you there?
Well, that's funny, because sometimes I'm not nice. I wish I was more diplomatic at times. But I become very passionate and sometimes a little bit too focused for my own good, and maybe but I will say, look, this isn't about a law or a recommendation. This is about what's going to happen to you or a patient. And if you're moving forward just a little bit, you're making it safer. So what is one thing? What's a couple of things that you could do that might be a little bit of a stretch for you, but it is going to create a safer space in this practice? And usually it's linked to, it's going to cost this amount of money.
For sure. Or this amount of time.
Time. Time is money.
Absolutely.
Time is money. And so you think, I get all of that. And yet with that experience of seeing what can happen through the risk management, that year spent, if you don't have checks and balances in place, things happen. You work with people.
Totally.
People are going to make mistakes. And if they make a mistake and someone comes in and they hold you accountable for it, it is much better if the scenario is they had stellar processes in place, but that human error entered in, than nothing was in place to protect on any level. So what do you have in place that is setting you up to reduce that risk of a bad outcome? So just trying to explain it from that perspective. Oftentimes I find that more the frontline workers want to do everything that you say, but they're not really in a decision-making position. So they have to go to leadership, and sometimes that's a challenge in talking to the people that are going to pay the bills. Because you have to be able to pay for your staff. You have to, make money. I mean, you have to pay off your student loans. You have to, all of those kinds of things. So helping them understand that the things that we're talking about really overall reduce your liability. Reduce your
There
liability.
is a hidden ROI to this.
Absolutely. Absolutely. Let me give you an example. If you had to send somebody to the hospital because they got a stick and they were exposed to someone else's blood, you can look at $4,000 to $5,000 out of pocket on that. So let's go back and see why did that happen? Are there measures that you can put in place that would prevent that person from becoming injured? So that's basically what we're doing. These are your risks. What are you doing to protect your patients and your workers? Because, if you make a patient sick, there's going to be some accountability there. And if you weren't following the correct processes, then that accountability gets bigger and more painful.
And we've even seen since really COVID, there's like a new awareness of infection control and proper safety procedures. And so even customer retention is improved when they're seeing that you're doing the right things.
No, they're watching.
And
there's this I think, a little bit of a fear as well.
Mm.
I want to know what you're doing. And thank you for bringing that up, because sometimes when I'm talking to people, I remind them, tell the patients what you're doing to keep them
Yes.
safe.
Yeah.
Because, I mean, there's studies that show if a patient is loyal to you, they're not going to leave.
Mhm.
And part of loyalty is trusting that you're going to do the best for them. So talk to them.
Yeah.
I mean, they walk into this environment that's intimidating anyway.
Yeah.
You're going to lay me back. You're going to put something in my mouth.
Yeah.
Then, and then there's going to be funny noises.
Yeah, right.
Okay. So, but these are the things that we're doing to make sure that when we're doing all of those things, you're going to be safe.
That's so good.
Yeah, conversation.
So good.
But sometimes there's not that conversation. Okay,
Yeah.
we're going to do this, and this.
Mm.
But tell them why and how we're going to do that
Yeah.
safely. I think that's so important.
I love that.
Yeah.
From your time doing risk management,
Yeah.
what are some of because I love the checks and balances. So I
Yeah.
kind of want to go back to like, how do you help create that infrastructure with teams that are like figuring it out?
Oh,
And what are some of the principles or insights that you've kind of taken into the dental world from that experience?
documentation, which
Yes.
is a nightmare.
Yeah.
Documentation is a nightmare across the continuum. This is not just in dentistry.
Yeah.
I was involved. The only time I was involved in a legal matter as a practicing nurse, I was subpoenaed to come in, and they showed me the patient had died. The doctor missed the diagnosis: Rocky Mountain spotted fever.
Oh,
The
man.
patient died.
Yeah. Wow.
And the opposing attorney put what I recorded in the medical record in front of me, and my heart sank. If I had to stand on that, could I defend what I did? It should have been a lot more robust. But bottom line is, we're in a hurry.
Yeah.
I got to get on to the next thing. So documentation of what you're doing. Documentation of what you're doing to make sure that the equipment that you're using is appropriate. Documentation of testing around dental unit water lines, because, and this is what I say to people, the only time you're going to need it is if you're in trouble. I'm going to just be honest with you. Nobody's just routinely going to say, hey, let me see how you're doing with your compliance. It's usually driven by some kind of complaint or some type of bad outcome. So that's one, and getting a process in place and sticking to it. This is what we're going to do every day, not just when we feel like it, but on this day we're doing this, on this day we're doing this. It takes a while to get the process, not a terribly long time when we're talking about safety, but identify those processes, get them in writing, and then follow them. Don't put it in writing if you're not going to do it, though. I will tell people, if you write this, and this, and you think there is no way the people that we work with are going to be able to do all these steps, don't put that in writing then. Put in writing what you can do, making sure that it meets those minimum expectations for safe care, and then follow that. Educate the people too. Don't go, it's in a book.
Right.
You should have read that. You have to sit face to face with them. Or, it's lovely if you're right there demonstrating. These are the things that
hands-on training.
You should absolutely show. Almost like a show and tell.
For sure.
Yeah.
What are some of the other, it feels like documentation is one of the things that maybe a lot of teams might struggle with.
Right.
In your experience, what are some of these other like pitfalls or obstacles or challenges that most teams are going to come up against when they're trying to elevate their standard of care?
Legacy training. We've always done it this way. I think those are the most dangerous words that I will hear if I'm talking with someone is, we're going to do it this way. And I use the word why a lot. Why? Well, because Sally told us, and this is the way Sally did it, and that's just the way we do it.
Right.
So not really understanding why they're doing things. I think it is really important for people to understand this is not just something that is good for you. We can go back here and talk about the fact that in this guidance, well, let's use fingernails as an example. Interesting discussion. So in the hand hygiene guidelines, it talks about artificial nails and wearing fingernails that have that are painted and chipped.
Yeah.
And really, you should not use artificial nails in high-risk environments. So if you're in an OR, if you're working with in the NICU,
Yeah.
you're doing any kind of surgical procedures, those kinds of things. But people don't understand why. Why would the CDC put out some guidance in there?
Yeah.
If you go back and you read that whole document, there were 5 little babies in NICU that died from Pseudomonas infections. And when there was an investigation, they were linked to nurses who had artificial nails, and they could not do adequate hand hygiene, and the Pseudomonas was colonized under their nails. So that makes the reality of this is why we don't do this. And a lot of people are missing that why. It's a task.
Yeah.
I do a task.
Yeah.
I've got a task list. Well, why are you doing that?
Well, I even think, and it's easy to do this as a trainee or a trainer, and it's like I'm giving the information for them to do.
Right.
And so I lose the why that originally infused this new rule or new regulation. It's like I forget that because I'm like, let's just get you up to speed so you can do it.
Exactly.
So you can be on. Yeah, exactly.
And we're in a hurry.
Yeah.
Because we're already working with not enough staff.
Yes.
So we got to get you up and going.
Yeah.
But if adults need to understand why, if they have that rationale, I think they're more likely to comply. My experience.
Yeah.
And sometimes if they understand the why, it can actually save them money. Believe it or not. Worked with a group just last week, and they were talking about the instrument reprocessing. And they said, oh, yeah, we soak all of our instruments in a chemical disinfectant. And I said, why? You're going to sterilize them. Why?
Right.
Well, that's the way we've always done it.
Yeah.
So we were able to work through the process of you don't need to disinfect something that you're going to put in a sterilizer. So that not only saved them time, because they don't have to go through that step, it also saved them money on the chemical that they were using to soak those instruments in. And, who knows, soaking those instruments in that chemical, can that impact the longevity? So there's a lot of things that if people understand the why.
Yeah, so helpful.
Yeah, it is.
Yeah.
I think it is.
And to the buy-in and ownership of like, this is why this is important.
I can explain to you.
Yes,
so I love doing that.
Yeah.
Sometimes I get on people's nerves though. Why? No, how do you
why?
ask me that? Why you ask that
Yeah.
question? I don't know. My mother said that I have been asking questions since I could talk. I've always... I try to balance that, but it's partly me. If I understand why, then I can also explain it to people, which that's what I see my role as. I'm going to help you understand what you can do.
Yeah. Well, I think to that original obstacle of, well, we've always done it this way.
Exactly.
You need the questions to help break that up and be like, oh, I don't know why we... Yeah, that doesn't really make that much sense.
No,
Let's
it doesn't.
figure out a new way to do this.
It.
Yeah.
Let's talk about it. And it is a change. And, sometimes people are not so great with change. I lead that. I'm not. I am a late adopter. I'm just going to tell you that. I like for things to be.
Yeah.
But if you can convince me or explain to me why this is important, then I am more likely.
Yeah.
So kind of use my own personal experience with that.
I love that. How have you seen, this might be a touchy topic, with where we are today. Has DSOs helped compliance, and how have they? Let's keep it at that. Let's keep it on the positive. Let's keep it on the positive. Yeah. How has DSOs helped compliance?
Okay, so first of all, when I was working in medicine, it was the environment that I was in was comparable to what a DSO is.
Yes.
I worked for a hospital system that basically owned, when I first got there, 60 medical practices, and it was well over 100 by the time I left. I would say to you from my experience there that sometimes it's hard to push information down to the frontline people because leadership has it.
Mm-hmm.
You know, I was their compliance person.
Yeah.
But when you look at 120, and I know these DSOs have way more practices than what I was dealing with, how do you get that compliance message down to that frontline person? So I think that they have the resources to do it. And I think that when you can have that many practices and hopefully they're doing things the same way, you can create a safer space. However, I believe that the challenge when you work with an entity that large is getting that compliance message down to the front person. And so when you look at what is an indication of a strong compliance program, do you know what the answer to that is?
Can I take a shot in the dark? Is it good communication?
Well,
I feel like that's a piece, but that's not the whole.
No. That's exactly right. But the way that you would prove that there's been good communication is I would go into that practice and go to that frontline person and ask them a question related to their safety.
Yeah.
Or where would you find this type? Where would you find your safety data sheet? Where would you find the instructions for use for this? If they can't answer that, then that really is an indication that we've got some work to do here.
That's so good. I've heard, and I feel like this is this correlates. I've heard culture cascades down, but you measure the other way. I feel like communication is kind of doing the same thing. It's like you can have all of the right things in place at the top. Right. But the real measure, to your point, is like, I'm going to ask the person that's implementing it if they understand to the degree that the top does.
Yeah.
How have you navigated? What are some of the things that you've seen done really well in that regard?
Well, the way we made it work, because I haven't really worked a lot with DSOs. My experience of how we made it work was we had a point person in every practice.
Ooh.
And that would be, I would say, comparable to an infection control coordinator.
Yes. Perfect segue.
It was, we had that point person, and I was responsible for communicating with them. Here's what's happening.
Yes.
Here is what your role is.
Yeah.
Here are the tools that you need. But then we would go, I had a couple of people that worked on my team. They would go out and audit.
Okay, cool.
And they had, you know, I think you need to see. I mean, people in healthcare are smart. They can give you the right answers.
Yeah.
For the most part.
Yeah.
But when you go and say, okay, show me, or, you know, let's talk further about it, that's where you see, do they really understand? And so we would go out and we would do these, I hate to use the word audit, surveys.
Sure. Yeah.
And there were key things that were related to safety. I think that's how we made it work.
Yeah.
And honestly, even with that, we had a third party that came in and worked with some of the practices from a compliance perspective.
Yeah.
Only because they were not biased.
Sure. Yeah.
And so I think when you have someone non-biased, a fresh set of eyes, for lack of a better word, you will see those things that day in and day out you go past and you miss because it becomes part of your environment.
Yeah. I love that you mentioned infection control coordinator.
Oh, yeah.
So I'd love
They're so important.
They are. Yeah. Tell me a little bit for those that might be unfamiliar with that, the integrity of that role and how and why it's so important. Who is that person? And then typically what are they doing?
Who is that person? Is the last person to be hired or the person that missed the meeting? Okay, that's typically what happens. But here in the most perfect world, it would be somebody that's passionate about safety. You know, a nerd like me.
Sure.
I mean, that wants to read the safety data sheets, that likes to look at, okay, here's what the CDC is saying, that likes to be on listservs. But they're that point person that's constantly watching and pushing out information and reminders. I mean, the reality is the world hasn't changed that much as it relates to safety. I mean, the bloodborne pathogen rule was written in 91, published in 91. 2003, CDC infection control guidelines. And the science hasn't changed a lot. I mean, there are some changes, but it's someone that's aware and that this is something that they're interested in doing.
Mm.
I mean, it almost has to be a person that I don't care if I have to spend extra hours outside of work. I know I shouldn't say something like that.
Sure.
But
But they are passionate. I love
they are
that word.
passionate.
Yeah.
It's passionate. It's I'm going to dig and dig and dig
Yes, yeah.
until I find the right answer. You know, we were talking earlier before we even started this.
Yeah.
How did you learn all of this? Oh, I taught myself, and so I think there's an element self-directed,
Yeah.
wanting to know more about it. I'm not always going to be waiting for someone to push that
Yeah.
information
They're like
to me.
curious about it. And
Curious.
they want to get the
Oh,
answer.
that's a great
Yeah,
word.
yeah.
Curious. They're curious. You know, because I'm that way. I couldn't tell you a list of all these courses that I've taken. I mean, I have. I'm not saying that I hadn't.
Right.
But a lot of it is being,
Yeah.
okay, what does this say about that? And what does that mean? And reaching out to industry experts and saying, would you help me understand this? So some of that self-directed.
Yes. Yeah.
Yeah.
I love what you just said there, because I feel like when we talk about the infection control coordinator,
Right.
it can feel very lonely very quick.
Absolutely.
And so connecting to people that have
Right.
wrestled with this, done this, is so important.
Right. It is. It is. And this reality of, yeah, I've walked that road.
Yeah.
You know, I know that this is not your only job. Your primary job is to do this, and you kind of fit it in. But the value that you bring is important.
Yeah.
I mean, if you can keep one person from having to go through that post-exposure process,
Yeah.
or if you can keep one patient from getting an infection, wow. You can't put a price tag on that. But I think the key is finding a person that's interested in it, not just, oh, it's your turn.
Yeah. Right. Right.
So
Someone that's really going to own it. Yeah.
own it. I love
Yeah.
it. Yeah. Own it.
You started your own
I did.
consulting company.
I did.
Tell me about that journey and some of the things that you've kind of gleaned along the way and learned.
Oh, wow. I had been with Total Medical Compliance 17 years.
Wow.
Yeah. They believed in me.
Yeah.
They supported me. I learned so much. But I came to kind of a crossroads. You know, I'm not as young as I used to be. And okay, X amount. How many more years do you want to work? And the answer to that is I don't know. I have no desire to not do what I'm doing. I love it.
Yeah.
But what do you want to focus on? And so my role there was much broader. I knew that I wanted to focus mainly in dentistry. I knew that I loved to talk about sterilizers.
Yeah.
Isn't that weird?
Yeah.
I loved instrument reprocessing. And so we were at a point financially, because that's a big consideration. And
for sure. Yeah.
that I could step away and, we could still eat and,
Yeah.
do all those things
It's a
and not
risk.
have a high level of
Yeah.
anxiety
Yeah.
about that. I am not, this may surprise you, but I'm not a risk taker. Compliance people oftentimes are not risk takers. So I made the decision to step out.
Yeah.
And I would just say that the Lord has opened so many doors that it has been this most amazing journey of being able, I find that I love to work with people that are more at risk. So for instance, being able to do the training that I do in tribal health clinics.
Yeah.
It was a grant from OSHA to the Association with Dental Safety. I love going into those environments where they may not have the resources to send someone to trainings or invest in, things that can put them at a different level.
Yeah.
So I've had a lot of those opportunities to do things like that,
That's awesome.
which has been great. And I've been able to focus mainly on, those areas that I don't want to say come easy for me, but it's stuff that I can absorb and it makes sense. Maybe it makes sense to me.
Yeah.
So just like learning about the dental unit water lines, it makes sense to me.
Yeah.
But if you were to say to me, okay, go over there and I'm going to teach you how to use that camera.
Right.
I would go, no way. You could talk to me all day long and I wouldn't get it. So it was matching what I love and what I can understand.
Yeah.
And it's just kind of all come together.
Yeah. And I love that you're able to, in doing something that's yours, there's like a missional component.
Absolutely.
With people that might not have access to what you're providing. You're like, I want to reach those people.
Absolutely.
Yeah.
I mean that kind of aligns. I know on your list of questions, we're going to talk about Mission of Mercy.
Yes.
Clinics. Can we hop there? Is that
we
okay?
can, absolutely.
We have one next week
that's
in
awesome.
Elkin.
Yeah.
That's a really interesting story. My first annual conference at OSAP, now ADS, I got on the van to go back to the airport, and I got a call from someone at TMC, and they said, the Dental Society has called, and they want someone to come and evaluate their infection control processes at a Mission of Mercy clinic because there's been an outbreak of hepatitis B at a clinic in West Virginia.
Yeah.
And I was like, oh, okay, never been to a Mission of Mercy clinic. So that very next week, I went up to the mountains of North Carolina.
Yeah.
Went to my first Mission of Mercy clinic, and it became part of who I was.
Yeah.
It was the weirdest type of, oh, wow. Because there were so many, I can't help fix something in somebody's mouth. I'm a nurse, but I had the skills on, okay, I can do patient triage. I can do all of these kinds of things on the medical side. I understand the instrument flow and what the risks are. So at that point, I started working with the North Carolina team. They owned at that point all of the equipment, and they may do as many as 13 or 14 clinics in 1 year.
Okay. Wow. Okay.
So they were moving banks of sterilizers, maybe 18, 20 sterilizers from different cities, and would see hundreds of patients.
Wow.
And so what are the risks associated with that? Back in 2011, I think, I did the first Mission of Mercy clinic where I was part of the leadership team. We did a 36-hour clinic.
Wow.
Had a band in the middle of the night playing while dentists are fixing teeth and people are over there sterilizing. And I would say, as far as experience, that was the highlight of my entire career, that experience of seeing they took care of over 2,000 people.
Wow.
People that were in pain. You would see people that were acting out, not because they were angry. They were acting out because they were in so much pain and they were afraid they weren't going to get a turn. So you see this reality of need and access, and people have different opinions about Mission of Mercy. This is not a fix, and I agree. It's not a fix for access, but it is an opportunity to get people out of pain.
Yeah, solving immediate need.
It's an immediate need, and so I've been a part of those clinics ever since that first interaction. I'm just kind of observing. It's, I would say, anybody, if you have the opportunity to go and do one, I've never talked to anybody that's done one that walked away not impacted in a positive manner. It is an environment where you never hear, that's not my job. Never. It doesn't matter whether it's trash or what, taking care of instruments, unloading, packing up. Nobody ever says, that's not my job. Where else do you go?
It's so powerful.
It's amazing. And the patients are so grateful.
Gosh.
And treated with such respect.
Yeah.
Oh, the patients are treated with such respect. It is humbling.
Tell me more about that. How do you see that? What's unique about that?
It is such a controlled chaos.
Sure.
Control
there's
chaos.
so many people that need
you may be looking at, when we did our clinics in Charlotte, we had well over 100 chairs of dentistry going at any, and then there was a mobile hospital type of environment where they were doing oral surgery.
Wow.
So you've got, and you have that hundreds of people waiting, and they're all moving through a different process.
Yeah.
So it's like this chain of events.
Yeah.
And then I've witnessed this so many times, a dentist walking up to a patient who's scared. It's crazy. It's not private. I'm Dr. So-and-so, and I'm here to take care of you today.
Mm.
We're going to look at what's going on, and we're going to get you fixed up.
Yeah.
Face to face, eyeball to eyeball.
Yeah.
And it's just touching
Mm.
that they come right down to where that patient is and interact with them just like you would expect in a private practice, and yet we're not.
Yeah.
It's mashing
Yeah.
it. So there's so many of those things that you witness that just touch your
Yeah.
heart.
Right. I think a lot of times in dentistry, there's that balance in like trying to optimize for the most.
Yes.
And like, how can I get the most amount of people through to have the highest retention of profit and all that kind of different, just like running the business. What can dentistry learn from an organization like this about treating people uniquely?
Yeah.
That could be really powerful if we all shifted and operated more so like that.
Wow, that's an interesting question. I think when I'm there and I watch, I see the need and the reality of
You're good.
How privileged I am, and the fact that each person is important, no matter where you are on the spectrum.
Yeah.
And we all deserve to be treated in such a way that is respectful. I have never witnessed, in my experience in dentistry, not being treated with great respect. But I think when you come out of a little bit of a protected environment and you meet these people that struggle day in and day out for basic needs,
yeah,
you know, how can that not change you?
Yeah.
I hope, you know, wow, that was a hard question. Yeah, it's
yeah.
That's why I think it's good for people. It's kind of like going to a mission field almost.
It is. It gets people to, I think, in the everyday like cycle of my job or what I'm doing, sometimes it can be hard to slow down and like recognize there's another person that has a very different life in my chair. And they're probably going through a lot of things that I don't know about.
I would agree with that.
And
everybody's struggling with something.
Yeah. Yeah. And it could be hard to say, let me slow down and like recognize that.
Right.
And there might be fear here or anxiety here. And I'm going to try to bring that person in and invite them and say, this is a safe space. And I think missionally driven organizations prioritize that.
Yeah.
And sometimes that could be difficult in the everyday rigor of
Absolutely.
dentistry.
I think it has to be a conscious decision.
Yeah.
I have a precious friend. I adore him. I've actually known him. I met him through Mission of Mercy.
Yeah.
He was working as a pre-dent and actually became the manager of the clinic before he went into dental school. He is now a practicing dentist. He has a very successful practice. And a conversation with him a couple of weeks ago, and he said to me, you know, I can make more money. And I said, well, that's interesting, Craig. Where did that come from? And he said, I schedule an hour for every patient.
Wow.
He said, because he said, when I was going through a difficult time, so many people came and stood beside me and supported me. I want to do the same thing for my patients.
Yeah.
But that equated to, I'm not going to make as much money.
Yeah, right.
What a huge jump.
Yeah.
But he has had some difficult times. He was impacted, and realizing that people are struggling, and there is the opportunity to touch on that as healthcare providers.
Yeah.
It's the whole person. It's not just the teeth.
Yeah. And it does, you're absolutely right. It takes so much intentionality in that moment to recognize that there could be something here.
Yeah,
that I need to step into. Yeah.
Yeah, absolutely.
Which is a pretty natural segue to this new endeavor for you of recognizing, and what's the proper term that you use when you educate people on this?
Human trafficking awareness.
Human trafficking. Okay.
Yeah, human trafficking.
But that carries that same level
It
of like,
does.
there's something here. They're like, if I'm super intentional, I might be able to tap into someone else's pain and emotion. And so tell me a little bit about how you like kind of stumbled into that space, and you're incredibly passionate about it, and you've given multiple conversations and talks about it, and you're kind of becoming the leading voice for
Well, I
dentistry
don't know
in
about
this.
that. No, I don't know about that, but I would love to be one of the voices that because okay, so it goes back to when I stepped away from TMC.
Yeah.
And what am I going to do? What kinds of things am I going to talk about? And so in a period of about 5 months, I had mentioned to my husband, this human trafficking stuff is just, I'm hearing more and more about it. And I bumped into people. So for instance, I was in Boston buying a dress.
Yeah.
And through the course of a conversation, the young man that was waiting on me, he said, "Oh, my mom runs a cafe and she uses the monies to help people come out of human trafficking."
Huh.
I mean, just I was in the
like out of the blue. You're like, oh, okay.
Out of the blue.
Huh.
I went to a conference. It was actually the first time I'd heard an in-depth presentation on human trafficking. And I was sitting in the lobby beside a lady, very well dressed. Her husband was there as a dentist at the meeting. And she poured out her heart about her teenage daughter that had become a victim of sextortion. And there was just story after story.
Yeah.
And it was if the Lord was just saying, "Karen, I want you to talk about this."
Yeah.
And so I reached out to the North Carolina Dental Society and I said, "Hey, I got a topic." And they, sure.
Yeah.
Well, from that, I've had some other conversations. I've done some webinars. I have done 3 in-person presentations. Andrew, in every presentation, and I'm talking to people in dentistry, medical group managers, I have had people come up to me and say in every presentation, "Oh, we've walked that road," or "We're walking that road right now."
Wow.
That's not the model that comes to mind of human trafficking. And so I have had some opportunities to be on a stage. There is some awareness of my name in dentistry. And if I can use that platform to also talk about human trafficking and what that might look like in your practice, or this is what human trafficking is. It is not the white van coming and picking up your kid on the side of the road. That is not what happens in America. Then Lord, use me. Because without, well, first of all, in my experience of even learning about it, it was not what I thought it was at all. It is a very well-oiled machine. It is an industry. Yeah. $240 billion a year.
Yeah.
Second only to drug trafficking. It is very intentional. There's a game plan, and the people that are involved in this are savvy, and they prey on people that are vulnerable. And oftentimes we think of people that are at risk. They fall into certain categories, lower socioeconomic, people that addictions, people that struggle with sexual identity, or that fall into the different types of categories. And all of that is true. But no one is exempt from being impacted. Yeah. And when people say, "I had no idea," it just kind of validates, okay, I need to continue to talk and look for opportunities to share the message about why should you be aware of this.
Well, and it's so, I'd imagine it's so like, oh, I'm doing the right thing. And that every time you're having these conversations, people are like, wait, we're going through that, right? Like we're wrestling through
Right.
that right now. Like every single time you're bringing that up.
Yeah.
Drawing that into, maybe let's do some educating, I think, on this, just for
Okay.
people that might be like really unaware of how that relates to dentistry.
Okay.
And
All right.
then let's get into some, we can end our time with some practical
Okay.
intention, and intention applies to the whole conversation we've been having, but it also applies specifically to this
Yeah.
topic as well.
Okay, so there's some data, and if you're interested in learning more about this, the Polaris Project is probably the leading entity.
Okay.
They gather data.
Yeah.
All right. They are the advocate for people that are involved in trafficking, survivors. They do a lot of legislative work and things like that. But because they have this data, they're able to really paint a picture of what trafficking is. There is some reason to believe, based on this data, that up to 80% of people that are being trafficked interact with healthcare at some point in time, and it's not identified.
Wow.
So if you can educate healthcare people of what to look for, then are we going to make it easier for them to get the resources that they need to escape? Or to at least educate them about the fact that you're really in a situation that we refer to as trafficking. Because the reality is, if you, based on reports from survivors, oftentimes they don't even realize they're being trafficked. They feel like they deserve the behavior, that this is normal, that they are unworthy to live a life that's different. Now, factor in also some of them have been given drugs to create an addiction type of scenario. They have literally been beaten down to a point where they're just will do whatever they're told to do. Okay.
Yeah.
So you're dealing with a person that has been severely traumatized, and sometimes, again, not even aware that this is not an abnormal lifestyle. And so they come into your practice.
Yeah.
This goes back to developing trust.
Yes. Yeah.
Remember earlier we were talking about and having relationships. When you look at the scenario, I'll be quite frank with you. You're not going to pull somebody out of trafficking. You're not going to say, oh, that person's being trafficked, we're going to pull you out.
Yeah, right.
Unless they're a minor. If they're a minor, then you're obligated to call social services, report to authorities.
Totally.
All right. And so that's a little bit of a different scenario. But can you build trust enough that at some point this person can share information with you? You have the ability to offer them resources. If it's as simple as the trafficking hotline, you can call. This is confidential.
Yeah.
You can go to the website. You can actually text, be free. That's another way that these folks can begin that process. But we're also talking about once they're out. Okay, you've got a person here that has no way to make a living. In reading some of the reports, they may be missing teeth. How are you going to get a job if you're missing teeth? So there's this opportunity maybe to identify. There's this opportunity to help survivors.
Yeah.
In, okay, can we do some pro bono work to help with from aesthetics?
Yeah.
So that we can shore them up. There's not a simple solution, but being aware and trauma-informed care is a buzzword, looking at people that have experienced trauma. And one of the key concepts of that is that everybody has experienced trauma at some level. And as a result of that, and especially these people that have been extremely traumatized, they may act out in the practice, and instead of going, what's wrong with you? What has happened to you that would drive you to act in this way? And how can we make it better for you? So going back to, hey, my name is Dr. Smith, and these are the things that we're going to do. You're going to feel me touching your mouth. You're going to feel this. I'm going to do this next. Completely educating them and if they don't want to move forward, that's okay.
Yeah.
Allow
Yeah.
them to make a decision on their own. It is so complex, and we certainly can't touch on it all in this period of time. But just being aware that you may have somebody that you
Yes.
interact with
Yeah.
that's coming out of that scenario.
Yeah.
I can't not talk about one thing, if you would just allow me just a couple
Go
of
ahead.
minutes. It's this topic of sextortion.
Okay.
And this is something that I think every parent, every grandparent, every aunt, uncle, if you've got kids that you interact with, you need to be aware of it. And it happens through social media outlets. So Facebook, Snapchat, all of these things that everybody's on. And basically what happens is a relationship is developed, grooming, and someone misrepresents themselves, and they can talk romantic.
Sure.
Talk kids into sharing inappropriate pictures because, sometimes young people, they have no cause and effect type of thought process.
Yeah.
And once they get these images, then they will start to blackmail them. If you don't send me more images, if you don't send me money, then I'm going to release these images. Now with AI, they don't even have to get an image from the kid. They can create the image. And this, in my last presentation, I had a mom talk to me about the fact that she's just walked through that with her 15-year-old. They had an AI image, and they were blackmailing the young girl. Here's the thing that's so tragic about this. Back in 2001, 2021 to 23, the FBI and another organization got 13,000 reports of sextortion. In the investigation, they had over 12,000 people that were impacted.
Wow.
Okay. Out of these, 20 kids took their lives.
Wow.
Because they don't know what to do with it. The shame of, what if my parents find out? What if my friends find out? What if they see this image of me?
Yeah.
So being aware of what's going on with your kids and their phones is so important. And this touches every level of society.
Yes.
I think kids, as a general rule, are vulnerable. They're easy targets.
Oh, for sure.
And the freedom that they have.
Yeah.
But I'm very burdened about that, and this making parents or caregivers aware of the fact that this is a risk for your kid. Yeah. So it's tragic. It really is tragic. All of this stuff that can be so lovely can also be used for evil.
Yeah. But it goes back to this kind of this underlying thread throughout this whole conversation of it always takes intentionality.
Yes.
With your kids.
Absolutely.
With every patient that comes through. There has to be a slowing down and a recognizing that this is something, I'm interacting with another human being. There's something here.
Right.
How do I do this well? How do I handle that well? That if we had that frame of reference with our interactions every day, which is hard because we interact with a lot of people and we're very busy. But if we had that frame of reference, I think that would have such a profound impact on the people that we interact with and help and serve.
I couldn't agree more. We do get caught up and moving on to the next thing, and we're thrown constantly stimulated to the point that we're used to it.
Yeah.
And when we're not, I'm going to be honest with you, I find it very difficult to sit still. And so sometimes I will, and it's very rare, when I'm alone at home, I don't turn the TV on. I don't pick up my phone. Just the quiet.
Yeah.
Our society's not used to quiet.
Nope.
We got to be busy. We got to be doing.
It's uncomfortable.
If my family sees this, they're going to be laughing and going, "Oh, she never sits down."
Yeah.
I'm keenly aware of that, and it is something that I think is problematic. And just this need to constantly be engaging.
Yeah.
But it's okay to be still.
Yeah. Yes.
I mean, I think when you're still is when you can really figure out what's important.
Yeah. It helps prioritize
Yeah.
and reprioritize.
Absolutely. You kind of cut out the noise and
Yeah.
how can I make a difference?
Yeah. Karen, how can people find you?
Oh, okay. Well, I do have a website.
Okay.
It's not real fancy, but
Yeah.
I like it.
Yeah.
It's
yours. Yeah.
KarenGregoryConsulting.com.
Yeah.
I am on Instagram
Okay.
at Safety Stuff That Matters.
Okay.
I'm not a big social media person
Yeah.
as far as posting. I mean, I do some. Those are the two best ways.
Yeah.
Or you can email me, Karen
Okay.
at KarenGregoryConsulting.com.
Yeah, that's great.
Yeah.
Karen,
So,
thank you so much
thank
for being
you.
a part of the Safer Together podcast. This was great. I enjoyed it.
I enjoyed it too. Thank you for having me. It was a privilege to be here.